Hi, Bill Vales here. In this age of coronavirus, we have heard many new terms. We last spoke about exponential growth. Another term we have been hearing is flattening the curve. These terms are important to understand. Let's explore what flattening the curve means. We have been told to follow the medical advice of 1. Practice social distancing, 2. Follow stay-at-home orders, 3. Wear a mask if you must go out in public, and 4. Perform frequent hand washing. We have all seen the dire predictions for the number of deaths and infections from coronavirus. These predictions come from using statistical models that have various assumptions built into them. If the assumptions made in the models change, then the output from the models will also change. Therefore, constant comparisons between the models and the reality on the ground must be constantly monitored. Recall in the previous tech tip on exponential growth, we saw how rapidly the total number of infections and deaths could grow if nothing is done to mitigate the spread of the virus. We have also seen that as people practice the mitigation tactics, the rates of infection and death appear to slow. Keep in mind, at this time, we do not have adequate testing to determine key pieces of data. The amount of testing currently deployed is inadequate to rapidly determine for the entire population key data points such as 1. Who has the virus, and 2. Who had the virus and recovered. Also, since there is no cure for people that are infected with coronavirus, people will either recover or they will die. Most importantly, there is no vaccine or vaccination available for the coronavirus. Testing availability for the population at large is improving, but it has a long way to go. Therefore, the mitigation tools we have available for controlling the spread of coronavirus is 1. Socially distance from people, 2. Follow stay-at-home orders, 3. Wear masks if you must go out in public, and 4. Wash your hands. We can measure the effectiveness of these tools by comparing the predictions in the models with the reality being observed in the field. Okay, so what does flattening the curve mean and why is it important? On the chart, there are two curves and a horizontal line that represents the healthcare system capacity to care for people. The red curve shows the rapid or exponential growth of infection if there are no protective measures taken. That may mean people are 1. Not social distancing, or 2. They are not following stay-at-home orders, 3. They are not wearing masks in public, and 4. They are not washing their hands. Notice in the red curve, the number of infections grows fast, and it also comes down fast. Some results of the rapid growth is the healthcare system is overwhelmed. This is shown by the red curve extending over the healthcare capacity line. And number 2, another sad result, is more people die. The blue curve represents the growth of infected people if we follow the protective measures of 1. Socially distance from people, 2. Follow stay-at-home orders, 3. Wear a mask if you must go out in public, and 4. Wash your hands. That is, if we mitigate the problem, we can influence or change the predictions reflected in the curves in the models. Using protective measures results in 1. The healthcare system is not overwhelmed. 2. Less people die since the healthcare system can care for them. And 3. The total length of time that the infection spreads increases. Yes, it does increase in time, But since the healthcare system is not overwhelmed, it will have the ability to care for the infected people. We can see that if we flatten the curve, there are potentially less deaths occurring since hospitals will have that capacity to care for the infected people. The tools we have to flatten the curve right now are 1. Social distance. 2. Follow the stay-at-home orders. 3. Wear a mask in public if you must go out. And 4. Wash your hands. I hope this helps to explain what flattening the curve means and why it is important to follow the mitigation tactics. Please stay safe and please stay healthy. I look forward to seeing you all soon.